I'm going to talk a little bit about what hospice massage is and also what it is not. It is a non-pharmacological alternative in helping to reduce pain, fear, anxiety, and worry while increasing comfort, relaxation, and peace. And that's pretty self-explanatory. A lot of times when I go in to see a patient, if they are very anxious or painful, if you can get their anxiety under control, oftentimes the pain will get less as well. In the same way with nausea and vomiting. If they're relaxed, they're going to be less painful. And when you can create a situation where they're less painful, then you can give less medications. So that's really one of the primary goals of hospice massage, is to reduce the amount of medications that you need to have, and to create comfort and relaxation and peace. So it reaches many levels. Generally, when I get a massage referral, patients just start out by receiving a massage 1 to 2 times per month. Now, there are occasions when, if a patient is really anxious or painful, those massage visits will be increased to weekly if needed. But typically, the protocol is to be twice a month. I'm the massage therapy coordinator for Hospice of Mercy, but we have 3 other therapists that help us out. One gal who is a therapist at the Women's Center at Mercy, she helps us out 1 day a week. And then we have 2 other subcontracted therapists that help out when needed. So if I have more than what I can handle, I have the latitude to send those referrals on to those gals, and they make the contacts and see those patients on a regular basis as well. So there's 4 of us all together. And I would say right now with our census at hospice, close to 60% of all hospice patients are receiving massage. So I think that's a pretty good evidence-based practice, that it does make a difference. You know, when a patient is in hospice care, a lot of times they go through a variety of emotions. Sometimes if they've just had a new diagnosis, they're going through the process, and they're angry about it. This isn't fair. Why is this happening to me? And it causes anxiety. Sometimes people don't want to believe, how could this be happening to me? They get depressed and they're fearful. And sometimes people, especially with cancer, they feel isolated. See, people have a tendency to be afraid to touch people when they're sick. I don't know if they're afraid they're going to hurt somebody or what it is, but there's that feeling of isolation, that I'm in this all by myself. And massage is a modality that goes beyond that feeling of isolation, because touch is so important. I've always believed that, you know, when we come into this world as infants, part of what helps us thrive is to be held and to be touched. And I believe that it's just as important at the end of life. We need to touch people. It is so important. Massage therapy reaches the mind, body, and spirit. You cannot possibly touch somebody and have it just be a physical experience. And you'll see that today when you experience, hopefully. But generally speaking, if I'm giving somebody a massage, they'll say, "Oh, that feels so good." Well, just the fact that it feels good tells me that it is going beyond the physical, because it's affecting them emotionally. They're able to relax and be comforted. Massage therapy techniques in hospice is oftentimes different than a regular spa environment, or I know for 5 years I was in my own private practice before I came to hospice. And you know, somebody's got a real, you know, athletic build and they've got, you know, some tight muscles or something. I do deep tissue specific work. Well, you don't necessarily do that with hospice massage. It is mostly about being gentle and just providing comfort. Being present is so important. Even as volunteers, you know, if you spend time with patients, your presence with those folks is vital. You have to know how important that is. And with massage, it's the same way. Being fully present to a patient and really getting in touch with what they're going through and how they're feeling is really a huge part of it. It's a caring, gentle touch. I always use slow, purposeful gliding strokes. You don't want to get in there and rough anybody up, and you just want to create a feeling of smooth, calm. It's about giving attention with intention. You go in there and you set an intention inside that you want to create a feeling of calm, a feeling of safety, a feeling of comfort, a feeling of peace. So it's about attention with intention. There are very few contraindications to massage in hospice. The benefits far outweigh any of the risks in having it. Occasionally, if I have a patient that has DVTs, or deep vein thrombosis, that's a blood clot in the leg or something, you want to avoid the area that is in that, wherever that vein is, that could cause an embolism or something. But the benefits of massage far outweigh any risk. There's a time when some people thought that massage would spread cancer. It does not spread cancer. So just put that to rest. The massage that we do is not real deep. It's not going to, and obviously it just makes sense that I'm not going to go in there and mess around where there's a tumor or something like that. But there is no threat of spreading cancer. I mean, some people exercise, they take hot showers. All of those activities are going to increase circulation more than any massage would. So there's absolutely no risk of spreading cancer through massage. Massage is not intended to cure the illness, but rather to bring emotional and spiritual healing through the power of tender touch. So nobody's going to have a miraculous healing necessarily through massage, but there's a lot of different kinds of healing. And if somebody is really restless, or if they've had some old wounds through their life and they're trying to come to terms with things that are happening, massage can really help to relax them. Oftentimes people will share stories or share heartaches, things like that, because they feel comfortable enough to say, I need to talk to somebody. So it's very definitely a healing experience, but not a cure. Oftentimes people don't care so much about what you know, but they know how much you care. And they judge you by how you make them feel. And that would be true for you as volunteers as well. Those people who are 11th hour volunteers, or anybody who has direct patient care, those people know that you're there because you care. And that is so huge. You don't have to worry about whether you're doing the right thing or saying the right thing, but your presence and the fact that you show how much you care is a very powerful thing. And it's the same way with massage. I believe that the strongest thing in the world is tenderness. It seems like a contradiction of terms, but it really isn't. There's a lot of strength in being tender with somebody, and that's what massage is too. I think that's just a good way to live myself. And this is a term that I came across just a few months ago. Our fingerprints will not fade from the lives we have touched. And that's also true of all of us. You know, you can affect a life in a very positive way or a negative way. And certainly hospice massage is a powerful way to impact a life. I personally think that it's such an honor to be able to be a part of a person's journey at this time, to provide comfort and peace and relaxation at a time when there's an awful lot of life review things going on. And I respect and honor the opportunity to be with them and to be present during that time. So it's just an honor to be in this position. And I think that touch is eternal. I really do. I think that says it all. It's so important that we touch lives. We are the mercy touch. So we need to touch with mercy. So, have any questions right now so far?
What kind of degree did you have to become a massage?
I went to Carlson College for massage, and I'm a licensed healthcare professional.
You went to Carlson?
Mm-hmm.
I'm a granddaughter of that she wants to take.
Mm-hmm.
So you went to Carlson
Mm-hmm.
for how long?
6 months full-time.
6 months.
Mm-hmm.
And then you became...
Then I took state boards, and I was in Des Moines and got my license after that. So,
Oh my gosh.
yep.
That's really interesting.
And I do ongoing education,
Yeah.
periodically. The aromatherapy that you smell, can you all smell it? Yeah. I use that a lot with patients as well because it helps to really affect a person on a cellular level to create peace and relaxation. So sometimes I do energy work. I'm certified in healing touch as well. And if somebody's really painful, I'm able to place my hand on that painful area, and oftentimes the pain will leave. I mean, it's not magic, it's not voodoo, it's just a powerful thing because we are all energy, and pain is energy. So it's not, I have many tools in my bag. Any other questions? Go ahead.
Besides, if you should have
A massage?
a massage,
Well-
or if the patient asks for it,
Well, first of all, when a patient is admitted into hospice care, the admissions nurse or the social worker will do the initial assessment of the patient, and they go through with them, the patient and the family, all the different services that we can provide. And if massage is one of them that they would like to try, then they issue a referral to me and give me the information so that I know what the diagnosis is and any other pertinent information that I need to have. So that's how it's generated. Mm-hmm.
But to answer
Good
the
question.
Yes, the patient can ask for it.
Yes,
Anytime.
absolutely.
Anytime that they're in
Yep.
hospice.
Anytime, yeah. Even if somebody's been in hospice for, say, 2 months and they've never had massage, all they need to do is request it. Because, as their physical parts change, laying in bed more or whatever, the need is stronger for something like that. So you can take it at any time during hospice care. Yes?
you mentioned healing touch.
Mm-hmm.
Is that the same as Reiki?
No. It is similar in that it's energy work, but the technique is different. And I'm not a Reiki person, so I really can't say exactly what the difference is. But it is a different certification. Mm-hmm. Yes?
Any question, does massage bring about healing? What kind of healing?
I'm going to say emotional and spiritual healing sometimes. A lot of times, and I will just share, I had a patient one time who, for whatever reason, did not feel comfortable having a chaplain come visiting. It was a person who didn't necessarily have a good experience with organized religion or whatever. Anyway, for whatever reason, he didn't want to have a chaplain. But it was known to us as a team that this person also had some emotional baggage, some old wounds and things that needed to kind of be addressed. And he was willing to have massage. And so, as I developed a relationship with this guy, he began to feel very relaxed and comfortable and safe. And on his deathbed, he said, "I need to tell you something." And so he was then able to get that out of himself. That's when the healing begins. And then he was able to let go and pass. But, there's a lot of things that happens to us in life that we just hang on to. And it's just a powerful thing when something like that can happen. So it's not a direct healing as a result of massage, although he felt very safe and comfortable through the massage. But it's about developing a relationship that creates that safe place where those things can occur. Does that make sense?
Thank you.
Mm-hmm. Good. Any other questions? These are great questions. Don't mean to have my back to you guys. Okay, so what we're going to do next is I'm going to give you a demonstration of a hand massage. And Dorothy Getzinger has been so kind to be my volunteer. And yeah. Don't trip over this cord. Mary, would you hand me a bottle of lotion and this? So if you want to position yourself in a way where you can kind of see.
Where do you want me?
Right here.
Not sitting on the phone.
No. I'm going to have you take your watch off. Can you all see? You might have to move. Huh? Yeah. Okay. This is just a small part of what I do, just to demonstrate. But here again, I'm going to bring up the point of being present to the person. I feel like even when you're massaging a hand, it may seem to an onlooker, oh, she's just massaging somebody's hand. I think, rather, you're embracing a whole life. Because there's a lot of history in these hands. These hands have hugged a lot of people. These hands have tied a lot of shoelaces. I mean, whatever. She does yard work. She plays the piano. She does everything. But I think it's important to be mindful that you're embracing a life when you touch anybody. But especially the hands, because there's something special about hands. And I usually warm my lotion, so this isn't warm, so. Okay. I put it in the microwave. Oh, it depends on how. Yeah. Not to boil, no.
10 seconds maybe?
15 maybe, depends on how. Yeah. So I start out just by gliding, you don't want to use a lot of lotion, just enough to kind of glide over the skin. And there again, it's not like this. This is how you not do it, okay? And I want you to be mindful of what you're feeling as I'm doing this and the difference between how not to do it. Does this feel...
That feels abrasive.
It feels abrasive.
Yeah.
That's a good word. How does this feel?
Oh, wonderful. You can just keep doing it. Very relaxing.
It's very relaxing. Does it feel safe?
Yes.
So it's important to, if you don't have a pillow underneath their arm, it's still an important piece to help them to feel like you're really supporting them. Because there again, you're holding this person's life. So it's not so much about technique, it's about presence, it's about purposeful strokes. Sure, you're moving some lymph, you're moving some blood, you're moving muscle tissue, all those things. But it really is about providing comfort and relaxation.
Very relaxing, very calming.
And then when you get to the hand, there again, you want them to feel supported, because on an emotional level, if you support their hand, they're going to feel safe, they're going to feel supported in all ways. So this doesn't feel very good, does it?
No, it feels wimpy.
Okay. What about now?
Oh, that's great.
Feels,
This is very,
yeah. You feel
very
supported.
much supported and
You feel supported.
together.
And at a time like hospice, it's so important that they feel supported. It's that mind-body-spirit connection. If you touch them in a loving, supportive way, they're going to feel supported in all ways. So I just slowly go up and down the metatarsals, and I kind of squeeze and caress.
Makes me want to take a nap.
And then I slide down and I stroke each finger several times, almost like milking a cow. There again, you don't want to have too much lotion on it. If you have too much, it's just slippery. You want to have enough that you can glide and squeeze and Now, would you have thought that having a simple hand massage would be this relaxing?
No.
Yeah. Then I bring their hands either this way or this way and do the underside. Sometimes it puts kind of a crick in their wrist so it's not as comfortable depending on the angle. So you can do this. And oftentimes when I feel that it's appropriate, if somebody is truly at end of life, maybe even unresponsive, when I'm doing the hand massage or legs or feet, I will do what I've kind of coined end-of-life legacy massage. And what that is, to me, is that, we spend there's a lot of history that is about to leave this body when they're in their dying process. And I verbally, whether the family's there or not, speak out loud, and I try to give credence to the ways in which this body has served the life that is now about to leave. We spend a lot of time and energy preparing a body for burial, but I think it's important that we prepare a body for death. And so to give credence to the hands or the legs and the feet in whatever way that body has served this person in this life, I think is worthwhile. It's not appropriate for everybody, but I think it is worthwhile, because you never know what they hear for sure, even if they're alone. So I'll just say, I had one guy who was quite the fisherman. So I said, how many fishing poles or reels have these hands cast into the water? And, I think it's important just to make mention of the ways in which our bodies serve us. And then when you're done, just a simple, gentle release. Not like this. That's how not to do it, okay?
Do you want to turn your chair to the other way?
Sure, we can. Be careful of the cord.
Do the other hand now for Dorothy.
Oh,
Yeah.
please.
Show balance. Massage my hand on the way out.
Oh, that feels so good.
Yes.
How long do you normally spend with a patient when you go out to see them?
Generally at least a half hour, but it depends on the situation. It's not carved in stone. Sometimes I'm with a patient much longer depending on what may be going on. Feel good?
Oh, that's wonderful.
I always start with the forearms. How many are getting relaxed just by watching this? See? Hospice of Mercy just wouldn't be all that it is without each and every one of you doing what you do. So I applaud you. I appreciate your presence here, and in whatever capacity you do Hospice of Mercy, we appreciate you. So thank you. But with that, I want to recognize that I personally think that we are the hands and feet and the voice of Jesus. And we are the body of Christ, and without us, where would ministry be? So this is a song that I'd like to share with you. And this is a song that I learned, not too long before I had completed my massage therapy school. And so it's kind of my theme song, if you will. Whoop. My hands are the Lord's hands. Without me, how how can his work be done? I will reach where he would reach, loving kindness in my touch. I'll be his healing hands to everyone. My feet are the Lord's feet. Without me, how can he walk with the poor? I will go where he would go, blessing others as I do. For him, I'll walk where I've never walked before. Help me, Lord, let me give to my neighbor what you would give if you were here. Help me, Lord, let me live so my neighbor will know that you are always near. My voice is the Lord's voice. Without me, how can his voice be heard? I will say what he would say, speaking love and life each day. And everyone who's near will hear his word. Help me, Lord, let me give to my neighbor what you would give if you were here. Help me, Lord, let me live so my neighbor will know that you are always near. My hands are the Lord's hands. Without me, how can his work be done? I will reach where he would reach, loving kindness in my touch. I'll be his healing hands to everyone. Thank you. God bless you.